My name's Dr. Caroline Dimond and I'm the Director of Public Health for Torbay. It's a local authority post, but I also work very closely with many other partners in the Bay, for example the hospital, the police, the clinical commissioning group, and also importantly with community and voluntary sector groups. I also work very closely with our councillors in the Bay. This video clip is about the annual report for the Director of Public Health. It's a statutory requirement, but I've made a video clip this year so that more people maybe could hear my message. In my 2016 report, I've set out some particular challenges that I think we need to address in partnership across the Bay. First of all, I think we need to continue to shift the focus to prevention, self-care and early intervention. As I've said before, we've begun to work as a team on prevention across agencies. I co-chair the South Devon and Torbay Prevention Board, which oversees this work. It would be easy, as budgets get squeezed, to cut back on this work. We must not do this, as our key is to prevent further escalation of health and care costs. Secondly, we need to continue to work to create happy and healthy places to live. This is the work of the Healthy Torbay group. This group looks at the causes or determinants of ill health, such as housing and other environmental factors. We've recently refocused this work, and it's important that we continue to prioritise it, especially as it will help us address health inequalities. This was the subject of my 2000 report, which was about tackling deprivation. Thirdly, we need to ensure that children and young people are given the best start in life to build aspirations for our young people as they become adults. I passionately believe that we must prioritise health and well-being in children, especially emotional health and well-being, and especially in the early years. This is why we will continue to work closely with our colleagues in children's services and in the NHS on an integrated service for the 0 to 19-year-olds, with a focus on promoting the well-being of families and providing early help and support where needed. The fourth priority is improving the quality of care and safety for vulnerable adults and families, and that's a particular focus of my report this year. Over the last year, I've talked in particular to colleagues in the police and the voluntary sector, whose role is to support and keep safe these vulnerable people. They're working under extreme pressure, and they're seeing many more of these complex individuals who are facing multiple complex needs in their lives. We need to continue focusing on this particular group. The fifth priority is enabling older people in Torbay to age well. We've got a particularly large proportion of older people in the Bay, and I believe we need to focus on them not just as problems, but in particular as assets that we have. We need to regard them differently, and we need to support them to live fulfilling and active lives. This is particularly the focus of work of the Community Development Trust in Torbay. Emotional health and well-being is a focus across all of these priorities. It's not really a separate piece of work, but we must ensure that emotional health and well-being is a priority in all areas. People's ability to nurture and raise their families, to lead healthy lifestyles and to lead active older years is very dependent on their emotional well-being. In summary, this year I've become particularly concerned about those people who face the most challenging issues in their lives, and that's why I've made this the focus of this 2016 report. They first face particular hardships, and there are real inequalities in Torbay that we need to address, despite some of the beautiful views around me right now. We know, for example, that more people experience domestic violence than in other areas. We also have very high levels of child poverty. There are high levels of sexual violence and rape, and in Torbay these rates are increasing. There's also a lot of homeless people. Though the numbers are small, they are increasing, which is a concern. And there are also a large number of people who are admitted to hospital, either because of alcohol or because of other health issues related to alcohol. In order to address these, we very much need to work together. And I'd like, if you have time, to look at the report that goes with this audio message to understand more details about how you could support these group of people and some of the challenges they are facing. In order to understand this better, we've actually talked to some of the people who live in Torbay about their lives, about the challenges they face day to day, but also about some of the support they've received. I would encourage you to listen to some of these audio clips, which you'll find attached to my report. These conversations have been anonymised to protect identities, but they're read word for word by actors. I think you'll find them very interesting. I have, and I hope they can help us think about how we provide services for this group. I passionately believe that this particular vulnerable group is one that we should focus on, and that's why I've given more details in my written report. I encourage you to read it. So that's all I wanted to say, but thank you for listening, and I'd like to pass on this message to anybody you think that might be interested. You'll find the report in full on the homepage at the Torbay Council website. Thank you.